Hi, I'm Jack Adams, and this is my presentation on wearable technologies in health and rehabilitation biomechanics. I'll start with a broad view on wearables and their applications, and then look more particularly at the use of inertial measurement units, or IMUs. Wearable technologies in biomechanics refer to devices worn on the body that analyze movement, such as joint impacts, limb motions, and load distributions. These technologies provide detailed biomechanical feedback through attaching sensors onto the body by inserting them inside items of clothing, such as bands or belts. Their versatility means they are used across various populations, from elite athletes to clinical rehabilitation. The focus on portability, real-time feedback, and use in natural environments provides a way of capturing motion that cannot be obtained from artificial laboratory studies. Wearables have several practical applications in health and rehabilitation. For injury detection, smart mouthguards use accelerometers to measure head acceleration in rugby, identifying possible head trauma. This detects cumulative load and informs a practitioner on the side of the pitch if the player has received a possible concussion and needs to be taken off the field. For load monitoring, IMUs mounted on the lower spine track sacral acceleration, allowing us to estimate forces and player loads during activities in real game situations, as well as in a laboratory setting. Additionally, wearables are used in aging populations to detect orientation changes, which can signal fall risks. This can alert a health practitioner that their patient may have fallen over, and help can be administered as quick as possible. We can also monitor load distributions in osteoarthritis patients through the use of smart braces and insoles. This allows us to prescribe recovery pathways using the data we gather from these wearables. All these examples demonstrate the diverse applications of wearable technology in biomechanics and how they apply in a health and rehab setting. Moving on to a specific example of a wearable technology, an inertial measurement unit, or IMU, is a compact sensor system measuring motion using three core technologies: an accelerometer, gyroscope, and a magnetometer. Accelerometers measure movement acceleration in three dimensions, x, y, and z, measures the change in position of a segment or limb from which we can then derive velocity and acceleration from. Gyroscopes detect angular velocity, tracking the change in angle and dividing it by the time it takes. Magnetometers assess orientation and position through the use of magnetic fields. These sensors translate physical forces into electrical signals, which are then processed to map an object's motion and position. This allows us to collect an array of biomechanical variables. Firstly, we can collect kinematic variables such as joint angles and segment orientation, and kinetic variables such as peak acceleration and shock attenuation. We can also obtain other variables such as jump height, stride frequency, asymmetry, and position-specific data such as a goalkeeper diving in football. One of the most advanced IMUs is the Blue Trident IMU, developed by Vicon. It features sampling rates of up to 1,600 Hz, real-time feedback capabilities, and usability in all weather conditions, and even underwater. 1,600 Hz allows it to track even the quickest movements. For example, the foot and ground contact time of elite sprinters. It can do this without providing any data blanks. Features two accelerometers, with the low G accelerometer tracking high fidelity movements up to 16G. This is so it can better separate noise and movement. If a movement exceeds the threshold of 16G, a second accelerometer will kick on and can measure the acceleration up to 200G. Its integration with Vicon motion capture system allows for precise movement analysis in real-world lab settings, making it ideal for biomechanics applications. It also can last for multiple hours before needing to be recharged, which makes it usable for endurance sports or a full day of testing. The Blue Trident IMU can be used in all weather conditions in the natural environment of the sport, which provides a way to capture motion with ecological validity. IMUs have revolutionized biomechanics by offering practical solutions in various scenarios. For gait analysis, IMUs attached to the lower limbs or integrated into insoles can estimate step length and assess gait asymmetry. In injury recovery, IMUs track joint kinematics during return to play assessments, comparing post-injury movement to baseline measurements. For osteoarthritis, IMUs estimate knee adduction moments and tibiofemoral joint forces, aiding in treatment decisions. Additionally, in older adults, IMUs can monitor temporal walking variables, providing mobility performance evaluations in natural environments and subsequent rehabilitation interventions. Onto a specific example of where IMUs have been used from a case study of Tedesco and others, 2016. They used two Tyndall wireless IMUs, with one placed on each leg on top of the knee, to assess 5 healthy participants and one recovering from an ACL injury. The IMUs captured an array of biomechanical data during activities like walking, squatting, and lunging. This was all done outside of the lab. The data collected was validated against the camera-based motion capture system, which showed high accuracy of over 80% in knee joint angle measurement and detecting atypical movements. This study highlights the validity of IMUs in rehabilitation. This is because we're comparing it to the gold standard, which is motion capture technology, and this can ensure practitioners that IMUs are measuring what they're intended to measure to a level. Onto a critical appraisal of IMUs. They have many strengths. Firstly, they're highly portable, so they're lightweight, wearable, and used in a variety of environments. Secondly, they are cost effective, offering a much more affordable alternative to optical motion capture systems. Thirdly, IMUs provide real-time feedback and immediate insights during rehabilitation or performance assessments. Finally, they have broad applications, including gait analysis, full risk assessment, and exercise monitoring, making them versatile tools for biomechanics. It also has a role in shock attenuation, which works through assessing the impact forces throughout the kinetic chain. This can determine if a player is at more risk of an injury if forces are higher as you move up the kinetic chain away from the impact. While IMUs do have many strengths, they do come with limitations. Sensor drift is a key challenge, as errors accumulate over time without external references. Additionally, IMUs are less precise than optical systems for complex motions and can provide some discomfort, which can hamper performance and also provide challenges with athlete cooperation. They also ban from certain game situations, as you may find in sports such as tennis. Sensor placement can also significantly affect output accuracy. For example, if the IMU is placed on an area with wobbly tissue or on an item of clothing, it can measure the acceleration of that tissue or clothing rather than the acceleration of the limb or segment. In order to mitigate some of these challenges, standardized placement protocols are used to ensure repeatable measurements, such as placement on bony landmarks. There are also specially designed clothing mounts that can ensure a better reading if the participant has excess movable tissue. Advancements have already been made in this area through items such as smart insoles, but furthering this with IMUs could be beneficial for validity and reliability. Another way to mitigate some limitations is where modern IMUs are fitted with better sensors and with improved temperature control, which can allow IMUs to track motion for a longer period of time and also reduce noise levels in its data outputs. To summarize, wearable technologies, particularly IMUs, are transforming health and rehabilitation biomechanics through a cost-effective manner compared to the laboratory gold standards of optical motion capture. They provide portable, real-time solutions for injury detection, load monitoring, and gait analysis, and provide a suitable method of bridging the gap between highly reliable lab-based assessments and what would actually happen in the real-world settings. While challenges like sensor drift and calibration do exist, the benefits far outweigh the drawbacks, and as wearables continue to evolve, their role in biomechanics will only expand, making them indispensable in optimizing health and performance. Thank you for watching.